Hi, my name is Lauren Zayaks. I'm here with Phoenix Concussion Recovery. I want to give a little overview to the practitioners of how they could utilize our website. So you go over to Practitioners from the home page, and we've got this whole section made just for you. So we've got a little video that I created just for you to show you exactly how the website works. And then we've got this little easy to use menu here. So who we are, what's the overview, and then I wanted to make it so it was really streamlined, not a lot of pictures, not a lot of excess. You can go and find exactly what you're looking for. So how do I identify a concussion? What are some supplement recommendations I can give my patients? How do I get my kid back into school? And then an overview of our early recommendations for the first week. We have this video here that you can share with your patients, and it's going to be exactly what people should do in the first 24 to 48 hours after a head injury based on the newest research. If you have patients in your office who have neck pain or headaches and dizziness, we've got little sections for you that'll tell you exactly what kind of therapy these people can do. And then there's also delayed healing. So you might have a patient in your office that's saying, you know, I had this concussion a month ago and I'm still having headaches when I'm on the computer. What do I do? And you may or may not actually know what to do with those people. And we want to be a resource for you. So you can go on over to our delayed treatment area and you can explore the different type of options that you can refer your patient to. And then, of course, we have our exercise portal. So this exercise portal is here to show you exactly what your patient is doing over time. So now in between those visits, you might not see your patient again until they were looking to be cleared. And you've really had no idea what they've been up to. And so that creates a lot of liability for you and a lot of ambiguity in the return to sport process. So we've created our exercise portal so that you know exactly what they've done, and we know that they're safely progressing back to sport, but also, and more importantly, that they're not deconditioned when they go back to sport, leaving them at risk for lower extremity injuries. So what your patient would do is they would come onto our home page and they could go to the I'm Concussed button, which is going to take them to that video again for the first 24 to 48 hours. It'll also take them to this treatment box over here if they click there. Or you might tell them just go straight into the exercise program, do Phoenix, come back when it's finished. And so you can have them click on exercise program here or exercise progression up here. And that's going to take them over to the sign up page. It's going to tell them what their $9.99 covers, which is those 5 detailed phases, their completion certificate to come back to you with, and then they have the 2 extra phases for returning to sport or for advanced workouts. Every section of our site has got 6 different strength phases, cardio, balance, and we've also included vision and vestibular exercises for our patients as well, and then a breathing and a calm down as well as flexibility. We've got our waivers and our terms and conditions, so every user has to agree to those. And then they're going to go in and sign up for the exercise program when they're ready. And they'll do the sign up now button. And it's going to lead them through a whole checkout. So I'm going to log in. And that's going to take me to my membership page. So when the patient comes back to your office, you can actually ask them to go over to my account, which is up here on the upper right. Or they can get there that way by logging in for you. And they're going to go over to view quiz results. And you're now going to be able to see all of their PCSS scores. So you'll be able to watch how their symptoms have trended and how they've answered them. You'll also be able to check out when have they actually logged in and how many days have there been in between sessions. So have they been a good patient, a compliant patient, or have they not been? They'll go back over to exercise programs. Here's where they actually do the exercises. Okay, so that same video is here again to explain how the program works. A few more little CYA sections and explanations on how the program is completed, so 1 phase per day. And every day they go in, they take their PCSS quiz, and they're going to answer these 22 questions. When they're done, they aren't allowed to miss any, and when they're done, they'll hit the submit button, and it's going to take them to a landing page telling them what their quiz score was. That quiz score is going to guide them through the 5 phases, so you can see how they're going to pick what phase they're going to go through. We do have a different starting point if they're less than 1 week out. Their symptom score needs to be less than 10 and steadily declining if they're less than a week out. Anybody who's more than a week out, they're going to be able to start with less than 25 on their symptom score. The reason why is that research is showing that early movement is really beneficial to recovery and improving their cerebral blood flow. Phase 1 is really just a dynamic warm-up, so let's go into phase 2 to give you an idea of what the exercise progressions look like. They have their cardio. They have their rating of perceived exertion sheet right here, so it's tailored to them. Each person is only going to exercise at their own level of 6, which is going to be different for you and me. It's going to be different for an elite athlete than it is for a 10-year-old, okay? If the patient is under 18, they need to have someone supervising them. Then we have our GIFs. We also have some explanations. If you know how to do this exercise, you don't need to read this, but if you're not really sure what to do or you're worried about being safe, you can go ahead and read our explanations for each exercise. You come on down, you have your balance, you have your flexibility. You can do 10 minutes of your own stretching, or you can click on our page to see what we recommend. And then there's different vision exercises, although we do tell patients if they're in advanced therapy, they should only do what that therapist has told them to do. And then, of course, we have our guided breathing. As we know, this mindfulness and meditation is really important for recovery. And then they're asked if their symptoms increased during the session. So if they did, they're going to get a landing page that recommends they go down one phase or repeat the same phase the next day. If their symptoms did not increase, then they're going to go ahead and get a success page. And as long as they don't increase over the next 24 hours, they're going to be clear to go on to the next phase. If your patient finishes phase 5, they're actually going to be able to bring their completion certificate over to you, and then they can go ahead and download their certificate. Okay. And here it is. So they can take a screenshot, they can save it as a JPEG, and that's actually described to them up here. So we've explained to them how exactly they can bring this to your office. It's going to tell you about our program. It's going to tell you what they did in phase 5. And then it's going to remind you that you are making the decision and that a qualified healthcare professional needs to be the final decision maker of whether or not you're able to return to sport. So thanks so much for your interest in our program, and we hope that we'll be able to help support your practice.